Hello, and welcome to this training. Today, we will be covering the basics of responding to sexual assault in the emergency department. This training is intended to give doctors and nurses a basic refresher of the laws and best practices when treating sexual assault survivors in the emergency department, as well as a rundown of evidence collection and preservation. This presentation is not intended to instruct on medical care, only to provide tools and knowledge for medical professionals to make educated treatment decisions. This training is presented by Hope Harbor, a sexual trauma recovery center. Hope Harbor is the agency designated by the Kentucky Cabinet for Health and Family Services, pursuant to Kentucky Regulatory Statute 211.600, to provide rape crisis services to the Barren River Area Development District. Let's get started by reviewing some of the language that we will use throughout this presentation, as well as some statistics that underline the importance of medical professionals having the knowledge to care for sexual assault survivors. Throughout this presentation, you may hear the word survivor used in place of the term victim or patient. This is because survivor is the term used by advocates to refer to victims of sexual assault. This does not mean using the term victim or patient is inappropriate. All three terms can generally be used interchangeably. The Sexual Assault Evidence Collection Kit is the tool provided by the Kentucky State Police Forensic Laboratory for standardized collection of evidence after an assault. The overall process of evidence collection is sometimes referred to as the Sexual Assault Forensic Exam, or just the SAFE exam. Rape Crisis Advocate is a legal designation for trained and certified victim advocates working or volunteering for a designated rape crisis center pursuant to Kentucky Regulatory Statute 211.600. Finally, Crime Victims Compensation refers to a program through the Kentucky Office of Claims and Appeals. While the Crime Victims Compensation Board's primary function is to compensate victims of crime for qualifying financial or material losses sustained as a result of their victimization, Crime Victims Compensation is also responsible for reimbursing hospitals for providing post-assault care and evidence collection services when the survivor's insurance fails to cover it. The statistics on this slide pertain only to Kentucky and were taken from the Kentucky Association of Sexual Assault Programs. As you can see, 39% of women have reported experiencing some form of contact sexual violence in their lifetime. Meanwhile, 18% of men report the same. Additionally, of the 39% of women who reported experiencing contact sexual violence, 1 in 2 were victimized before the age of 18. Let's move on now to talk about reporting obligations pertaining to sexual assault cases. Please be aware that the following information comes from Kentucky mandatory reporting standards and may not reflect perfectly the expectations of your hospital. Please consult your hospital policies and procedures for further information. Advocates are often asked how HIPAA relates to reporting standards for sexual assault, especially because of the obligation of hospitals to call rape crisis centers and have them dispatch an advocate when a survivor presents for post-assault care. We will discuss that obligation on the next slide. But it is important to remember that HIPAA protects patients' information except where disclosure is required by law. Hospitals are required by law to contact their local rape crisis center when a survivor of sexual assault presents to the hospital for post-assault care under Kentucky Regulatory Statute 216B.400. In turn, rape crisis advocates are required to provide specific advocacy services, which we will cover in the next section. Following a sexual assault, Kentucky's mandatory reporting laws require a report to be made to the Cabinet for Health and Family Services or to local law enforcement only in 2 very specific instances. The first is if a minor is assaulted, and especially when a minor is assaulted by an adult who has special authority over them. Special authority refers to situations of control or guardianship, whether permanent or temporary. Examples of positions of special authority can include, but are not limited to, parents, teachers, coaches, and babysitters. The second circumstance that requires a mandatory report following a sexual assault is when that assault is committed against someone classified as a vulnerable adult. Vulnerable adults are people over the age of 18 who, for reasons of mental or physical disability, are unable to protect themselves from neglect, exploitation, or abuse. Sexual assault against a vulnerable adult requires a report to law enforcement or to the Cabinet for Health and Family Services. Beyond these two specific situations, sexual assault is not required to be reported unless the survivor wishes for a report to be made. This is true regardless of the circumstances of the assault. Let's move on now to discuss rape crisis advocacy as it pertains to post-assault care at the hospital. The basics of rape crisis advocacy can be explained through three specific points. Who are the advocates? What do they do? And what don't they do? To start, let's explore who advocates are. All Rape Crisis Center advocates meet the statutory definition of victim advocate as outlined in Kentucky Regulatory Statute 421.570. In order to meet this requirement, advocates are trained upon hire and receive continuing education each year of involvement. Advocates additionally have criminal background checks conducted every 2 years. Rape crisis advocates are first responders to sexual assault and provide confidential and privileged services to survivors. The purpose of the advocate is to provide advocacy and crisis intervention services to survivors in the emergency department. Advocates, therefore, must be granted access to survivors in the emergency department in order to fulfill this legally mandated role. Advocates never break survivor confidentiality, except for in mandatory reporting situations as previously discussed. We also never give medical or legal advice to survivors, and perhaps most importantly, advocates never tell survivors what they should or should not do. The role of the advocate is to provide support and information to empower survivors to make their own choices. Let's now take a closer look at the functions that rape crisis advocates serve in the emergency department. The first function of the advocate is to provide the survivor with emotional support. Seeking help after a sexual assault is a very brave and difficult thing to do, and survivors often benefit from having dedicated one-on-one support from an advocate. Emotional support is tailored to the specific needs of each individual survivor. Material support is another important function of advocacy. Advocates bring materials to the hospital that can be helpful to the survivor. This includes new, comfortable clothing in case the survivor's clothes are taken into evidence by law enforcement. This also includes written copies of information the survivor might need after an assault. Informational support is another key factor of advocacy. It is the role of the advocate to provide the survivor with information about the exam, their reporting rights, how to go about reporting, and what will happen after, as well as their rights to medical care and evidence collection. All of this information is important because it can help the survivor make an informed choice about what to do after an assault. The final function of advocacy relates more to medical staff than to survivors. Advocates can provide support and information to medical staff who are not familiar with the evidence collection process, and can help coordinate efforts between the advocate, medical providers, and law enforcement if they are involved. The advocate's ability to provide one-on-one emotional and informational support to the survivor also frees up the medical provider's ability to focus on their specific roles of medical care and evidence collection. Rape crisis advocates also have limitations. Advocates are not investigators and do not participate in any legal investigation of sexual assault. Advocates also do not provide any form of medical care and do not participate in the evidence collection process beyond providing basic information about the process to medical providers. Advocates, therefore, are not able to determine the validity of any allegations made by the survivor. Additionally, as previously mentioned, advocates do not give survivors advice. Finally, because advocate interactions with survivors are privileged and confidential, rape crisis advocates do not participate in any court proceedings and cannot testify in court. Let's move on now to discuss the basics of post-assault care. As a reminder, the information in this presentation is not intended to instruct medical providers on how to provide post-assault care, but rather to outline treatments that you may wish to consider. It is important to know that there is a distinct difference between post-assault medical care and post-assault evidence collection. Nothing in the sexual assault evidence collection kit is medically necessary for the health of the survivor. Survivors may receive post-assault medical care without participating in evidence collection, should that be their wish. With that said, here are 5 things that may be included in post-assault medical care. Medical screening and examination to ensure the survivor is not injured or ill. HIV exposure, risk assessment, and post-exposure prophylaxis, if appropriate. A pregnancy risk assessment for survivors who can become pregnant. And STI and pregnancy prophylaxis, if appropriate. It is vital to remember that survivors may decline some parts of this care. Let's move on now to the evidence collection process. All steps discussed in this section are based on the Kentucky State Police Sexual Assault Evidence Collection Kit. Evidence collection includes the following things: collecting a detailed medical history from the survivor regarding the time right before, during, and after the assault. This includes an event recounting called the survivor narrative. Anatomical drawings and photography of visible injury are also part of this process. DNA collection, both from the survivor to establish their unique DNA profile, and from any affected areas of the survivor's body to establish the perpetrator's DNA profile, is a vital part of this process. Finally, clothing collection, at least of the survivor's underwear, should also be completed. Before beginning the evidence collection process, a few things should be considered. First, it is important to decide who will be involved in this process. This will depend on who is available and who can provide uninterrupted care to the survivor. This is because once the sexual assault evidence collection kit is opened, someone from the medical team who is collecting the evidence has to stay with it at all times. This is to maintain the chain of custody over any collected evidence. Doctors, nurse practitioners, physician's assistants, or certified sexual assault nurse examiners, or SANE nurses, may all complete the evidence collection kit unaided. Registered nurses without the SANE designation may assist in evidence collection. The next step is to collaborate. The advocate, the survivor, the medical staff involved, and law enforcement, if they are present, should come together to discuss who the survivor wants to be in the room during the evidence collection process, what their needs are before beginning, and how the process will go. This helps put the survivor at ease and make sure everyone involved is on the same page. The next step is to gather the supplies needed to complete the kit. This can include the kit itself, pen and paper, tape, and gloves. The swab dryer, a lavender toppered blood collection tube, and saline should also be utilized. The final step is to obtain informed consent for the exam process from the survivor. To get informed consent, the medical provider should explain the kit and evidence collection process and make sure the survivor knows that they have the right not to do the kit, to skip certain steps of the kit without penalty, and to decide to stop evidence collection at any point should they need to. Once the survivor is fully informed of what to expect from the evidence collection process, consent can be obtained. Let's now look at the basics of the sexual assault evidence collection kit. This is what the evidence collection kit looks like. Kits are manufactured specifically to Kentucky standards and are distributed by the KSP Forensic Lab. You will notice the kit specifically says it is for a male or female victim. This is the Universal Evidence Collection Kit in Kentucky and can be used for all victims regardless of gender or age. You can also see the white barcode sticker in the top right-hand corner. On that sticker is a website to access the kit tracking portal, as well as a kit tracking number. Each kit has its own unique tracking number, and once registered, the tracking number is used to track the location of the completed kit. We will discuss the kit tracking portal further in a later section. On the side of the evidence collection kit is another white sticker. On this sticker is the expiration date for the kit. It is important to remember that kits do not expire like milk. The expiration date is only referring to the sterile seal on the swabs included in the kit. Thus, if a kit is expired, the swabs can be replaced using hospital stock, and the remainder of the kit may still be utilized. More instructions for using an expired kit are on the blue FDA insert pictured on this slide. This insert is included in every kit. As with most things, completing the evidence collection kit requires some paperwork. Let's look now at some of that paperwork. The first piece of paperwork inside the kit is the evidence collection instructions. These instructions explain how to do each step of the evidence collection process. It is important to remember that each step of these instructions do not always have to be done in order, and providers likely will not have to do every step on every case. Remember that this kit is intended to be universal, and each assault is different. As an example, there are instructions in the kit for collecting anal and perianal swabs from the survivor. However, if the survivor you are working with was not assaulted anally, there is no reason to collect evidence from that area, and thus those steps can be skipped. The way to know which steps to complete and which to skip is by completing the victim's medical history and assault information form. This form has questions which allow the provider to determine what happened before, during, and after the assault. This information, in turn, allows the provider to know where evidence might be on the survivor's body. As such, it is important to be precise and concise when filling this out. This is especially true when completing the narrative section of this form. The narrative should describe what the survivor did directly before the assault, the basics of what happened during the assault, and what the survivor did between the assault and when they arrived at the hospital. It is vitally important that you remember how difficult and invasive this form can be for survivors. The questions, although important to the process, can make survivors feel worried that they did something wrong or that they can't remember important details. Additionally, the narrative may be the first time the survivor has attempted to retell what happened to them in full. The provider's job in this situation is not to push them to remember more or to chastise them if they struggle with any part of it. Their job instead is to support the survivor and record what they tell you to the best of your ability. The next piece of paperwork that comes in the evidence collection kit is the anatomical drawings sheet. This paper is used to show where the survivor has visible injuries. The location of any dried secretions, such as saliva or semen, should also be noted on this sheet. This sheet is used in addition to any photographs the provider may take. The final paperwork that comes in the sexual assault evidence collection kit are the evidence labels. The kit provides individual envelopes for each type of evidence with labels already printed on the envelope. Labels must be completed with the following information: victim name, date of collection, time of collection, name of the person who collected it, and any other information asked for by the label. If there are envelopes in the kit for which the provider did not collect any evidence, briefly note on the label of that uncollected evidence envelope why it was not collected. Let's move on now to discuss a crucial part of the evidence collection kit, establishing the survivor's DNA profile. In order for the state lab to identify offender DNA collected from the survivor's body, the lab must first establish the survivor's DNA profile. To accomplish this, providers can collect survivor DNA in 3 separate ways. The first option for collecting survivor DNA is through the blood standard. The survivor's blood must be drawn into a lavender stoppered collection tube and then deposited onto the blood stain card, which is included in the kit. The tube is not included in the kit and should be pulled from hospital stock. It is important that the blood stain card is completely dry before being placed back into its envelope. Any moisture left on the paper may eventually degrade the sample and render it unusable to the lab. We will talk more about evidence preservation later in this video. The next option for collecting the survivor's DNA standard is the known buccal standard swab. This is collected by rolling 4 individual swabs around the mouth of the survivor, particularly around their gums and inner cheeks. As with the blood standard, the buccal standard swabs must be completely dry before returning them to their envelopes. Buccal standards are often a good option if the survivor declines to have their blood drawn. If they do not decline the blood draw, it may still be a good idea to collect the buccal standard anyway. The more samples the lab has, the better their analysis and ability to identify the survivor's DNA profile will be. The third option for collecting survivor DNA is through the pulled hair standard. This step is just what it sounds like, pulling hair from either the head or the pubic region of the survivor. In order for either sample to be tested, 30 individual hairs from either the head or the pubic region must be pulled out and deposited into the corresponding envelope. The hairs must be pulled directly from the skin because the root of the hair is needed for the lab to process the sample. Plainly put, this is an awful thing for survivors to have to experience right after a sexual assault. Survivors commonly decline these steps. As long as either the blood standard or the buccal standard have been collected, the kit will still be testable. After the survivor's DNA has been collected, the provider should switch focus to collecting evidence from the assault. One step of the evidence collection process is pubic hair combing. Pubic hair combing is a way to collect evidence that may be caught in the survivor's pubic hair that corroborates their narrative. For example, if a survivor was assaulted in a park, there may be dirt, leaves, or other foreign materials trapped in their pubic hair. To collect this evidence, unfold the included paper towel and have the survivor sit on the edge of the paper towel. The provider should then use or have the survivor use the included plastic comb to comb through the survivor's pubic hair. Afterwards, the provider should fold the comb and any collected materials into the paper towel and then place the folded paper towel in the pubic hair combing envelope. If the survivor has no pubic hair or declines this step, the provider should skip it. Another step of the evidence collection process are the genital swabs. These swabs may be used for external penile swabs, internal vaginal swabs, or internal vaginal cervical swabs. For vaginal cervical swabs, a speculum must be used. The provider may not use any form of lubrication on the speculum prior to the exam. This is because the chemicals in the lubricant used by the hospitals may in some way degrade the evidence or render it untestable at the lab. If the survivor does not want the speculum to be used, the provider may simply insert the swabs without use of the speculum. Evidence may be collected from several different parts of the survivor's body. For evidence located in any area other than what we have discussed, use the other evidence envelopes included in the kit. Examples of areas these swabs may be used for include any area of the body that may contain the offender's saliva, blood, or other secretions, the perianal or anal area, the survivor's fingernails, oral swabs if the survivor made oral contact with any part of the offender's body, or the external genitalia of a female survivor. Once collected, these swabs should be added to an other envelope. 4 swabs must be used to collect from each site. Do not package swabs from multiple collection sites in the same envelope. Once collected, indicate on the envelope's label the nature of the swabs. There are multiple other envelopes in each kit. All swabs must be dry before returning them to their envelopes. Let's move on now to evidence preservation. It is vitally important that appropriate measures be taken during the evidence collection process to preserve evidence appropriately. Failure to follow these evidence preservation steps can render the evidence you collected in the kit untestable. Changing gloves frequently can help assure there is not cross-contamination between different collection sites on the body. Ideally, gloves should be changed between each step. Another important step in the evidence preservation process is using your hospital's swab dryer. The DNA evidence, along with other bodily fluids collected during the exam, are fragile. Exposure to moisture of any kind can cause the evidence to break down or degrade before it can reach the lab. This renders it untestable. It is crucial that all swabs and other evidence collected during the safe process be completely dry before returning to the kit. The swab dryer can assist with this. The swab dryer is a basic fan mechanism that blows room temperature air across the swabs, speeding up their drying time, and thus can assist in preventing moisture degradation of evidence. Let's now discuss the collection of clothing evidence. Although clothing collection may not be necessary in every case, It is important to understand the basics and ensure the evidence is collected and stored appropriately. Underwear is commonly collected during the safe process. Inside the kit is a wax paper envelope specifically for underwear collection. The underwear the survivor wore to the hospital, regardless of whether it was the underwear that was worn during the assault, should be collected, allowed to dry if necessary, and placed in the underwear envelope provided. Once the label has been filled out and the wax paper envelope sealed, the underwear should be stored outside the kit until the evidence is turned over to law enforcement. If the survivor is not wearing underwear when they arrive at the hospital, this step can be skipped. Additionally, other undergarments, such as pantyhose, bras, or spandex undergarments, should not be placed in the underwear bag. Those items, along with any other clothing that may have evidence on them, should be collected separately. This may include clothing with blood, dried secretions, or other bodily fluids related to the assault on them. If the survivor is working with law enforcement, it would be prudent to connect with the investigating officer to discuss which clothing should be collected. Each item of collected clothing, other than the underwear, must be dried and stored separately in a sealed and labeled brown paper bag. Once the evidence has all been collected, it's time to finish and seal the kit. All evidence envelopes should be labeled and sealed before returning them to the kit. Despite there being an adhesive strip on each envelope included in the kit, it is important to seal each envelope with tape. Never use saliva to seal an evidence envelope. Each kit has a unique tracking number assigned to it. That number can be found on a business card and several barcode stickers in the safe kit. The business card and stickers should be given to the survivor, as the number is personal medical information and it is necessary for the survivor to have access to that information later to look up the status of their kit. Once all sealed and labeled evidence has been returned to the kit, along with the victim's medical history and assault information form, and the anatomical drawings form, the kit itself must be resealed. To do this, fill out the kit box seal as depicted here, and then remove the backing of the seal and stick it in the indicated section on the sides of the kit box. The seal should cross the bottom of the box and touch both sides, creating a tamper indicating seal. The kit cannot be reopened after this seal is applied. Once the kit is completed, it must be entered into the Kentucky State Police Kit Tracking Portal. To reach the Kentucky State Police Kit Tracking Portal, you can simply search KSP Kit Tracking Portal. Select the first result and click Log In the top right-hand corner. At this point, you'll need to enter your facility's unique email and password to access your hospital's specific page within the portal. Once logged in, click the Add button in the top right corner. After reaching the page, you must enter the information requested. This process should be completed just after the safe collection process has concluded. If the kit is going into hospital storage, the information regarding pickup of the evidence by law enforcement can be added after the initial portal entry is completed. If the survivor chooses to complete the SAFE process without reporting to law enforcement, the hospital is required by law to safely and securely store the unreported kit for at least 1 full year after the collection date. Measures must be taken by the hospital to limit access to the kit as much as possible, and kits should be stored under lock and key. Even if the kit remains in hospital storage for a prolonged period of time, its location must be documented on the KSP Kit Tracking Portal. The final step of this process involves billing. By law, survivors cannot be asked to pay out of pocket for post-sexual assault care. So, if a survivor's insurance does not cover some or all of the post-assault care provided, the remaining cost must be billed to the Crime Victims' Compensation Board of the Kentucky Office of Claims and Appeals. Because the paperwork required by the sexual assault exam program of the Crime Victims' Compensation Board is subject to frequent change, it is best to visit kycc.ky.gov and navigate to the Sexual Assault Exam Program tab to locate the required paperwork. To access the required Crime Victims' Compensation billing paperwork, you can simply search Crime Victims' Compensation Kentucky. And select the top option. From there, click on the Sexual Assault Program tab and scroll down. Here are links to the associated billing forms, as well as a FAQs page for questions about the Kentucky Crime Victims' Compensation Board Sexual Assault Examination Program. This concludes this training video on responding to sexual assault in the emergency room. On behalf of Hope Harbor, thank you so much for all you do to serve survivors in our community.